Good evening. We're going to get started. You know, there's not very many people in the audience right now, but we expect that more students will straggle in here soon. Before I get started, I would like to thank the sponsors of tonight's forum. This is the Health Votes Montana 2014 Local Legislative Candidate Forum for the Missoula area. And thank you to AARP Montana and the American Cancer Society Cancer Action Network for putting this on. This will be aired on MCAT on October 14th and October 17th. And if you leave your email address outside, I will let you know the specific times that will be aired on those two dates. Come on in. I'd also like to thank the hosts for this evening. We had several other organizations be a part of getting the word out for the different forums as well, and that would be the Montana Nurses Association, the Montana Public Health Association, the National Multiple Sclerosis Society, Greater Northwest Chapter, and the Association of Montana Public Health Officials. And I am not going to take too much more time, so I'm going to turn it over to our moderator, who is, and we thank Asa Homan, who is the current ASUM president. He's actually in his second term as the Associated Students of the University of Montana's president, which is, I believe, the first time that's ever happened in the history of student politics here on campus. He also serves as the current president representing all of the higher education students on the board of what is it called? Montana Associative of Students. He's a political science major and will be graduating this spring and hopes to start law school in the fall. And one other sponsor I wanted to thank is ASUM for helping us co-sponsor this event. Without further ado, Asa.
Thank you very much. Thank you, everybody, for being here tonight, and to all of the candidates as well. One moment while I rearrange my microphone. Okay, first the rules. Tonight, the candidates have all received the questions prior to the beginning of this forum. I will ask each question to each candidate. Each candidate running for the same seat will have the opportunity to answer the question. There will be a timer in the front row to remind the candidates when their time has elapsed. They will be reminded at 30 seconds. By the way, when I said front row, I actually meant the middle row. Each candidate, they will be reminded when they have 30 seconds, when they have 15 seconds, and then they will be reminded when their time is up. I will quickly cut you off when your time is up, so please respect those time limits. We will allow about 15 minutes at the end of the forum for questions from the audience. And I would like to remind you all that while you will have 90 seconds to answer your questions, there will be no time for rebuttals. And with that, I believe we're ready to begin. You ready for question one? Oh, yeah. That's right. We're going to allow each candidate. We're going to start on the far right down here with Mr. Hopkins. And we will simply go from him to the very end with a 30-second candidate introduction. Mr. Hopkins.
All right. Well, hello. My name's Mike Hopkins. I'm 30 years old. I'm a fourth-generation Montanan, originally from Helena. This is my first time running for office, and I decided to run basically because I think that the way that politics is done today is rather pathetic. I think that you have a lot of politicians who want to tell everybody exactly what they want to hear and like to change it.
Hi, my name is Tom Facey. I'm a recently retired science teacher here in Missoula. I represented the Missoula County in the House from 1999 to 2006 when I was termed out. I was elected to the Senate, started serving in 2011. Thank you.
I'm Dick Haynes. I had 3 terms in the House. a long time ago, and I spent 8 years on city council. And I'm not running for anything past this point. I have some things I'd like to accomplish when I'm over there, which maybe I'll talk about sometime tonight. But other than that, that's all I have to say tonight. Thank you.
Hi, I'm Diane Sands. I'm running along with Dick Haynes for Senate District 49, which is the western end of the county, going all the way to Idaho. I have served 4 terms in the Montana House and was termed out as well. And I am running because I have a lot yet to do. I work primarily in the area of healthcare issues, but also in some areas such as state parks. I just retired from the Historical Museum at Fort Missoula, so issues of historic preservation, community integrity are important to me.
I'm Dave Strohmeyer. I'm running for House District 92, which stretches from East Missoula up to the Bob Marshall Wilderness up by Condon and Sealy Lake. I'm a former firefighter with the Forest Service. I'm a former city councilman here in Missoula. I'm a father of 2 small kids. I'm basically running for office because I want to make sure we have a legislature that looks out for future generations in this state.
I'm Willis Curdy. I'm running for House District 98, Target Range, Orchard Homes area. I taught for 30 years, 4 blocks down the street here at Hellgate High School. During summers, that's a Forest Service smoke jumper and Forest Service pilot. I'm running because I believe we need to focus on our K through 12, K through graduate school education program, job training, and we need to work at bringing living wage jobs to Montana.
My name is Roger Seawald, and I'm also running for HD 98. And again, it's Orchard Homes and Target Range. I retired from the Forest Service several years ago. I decided to run because I want to see cooperation over in Helena and not party politics. I want to see people work together and get things done. And based on the things that I was able to do in the Forest Service, I believe I can do that. I have 2 grown kids that graduated from college here in Montana.
My name's Kimberly Dudick. I'm running for House District 94. I'm currently the House District 99 representative. I represent the northwestern corner of Missoula County, from the north side all the way over through Frenchtown and Huson, where I grew up. I live in Missoula right now. I'm married with 3 young children, ages 9 months, 3 years, and 6 years old. And I work as an attorney at Browning, Calzac, Berienhoven, a law firm here in town. I'm also a registered nurse, and I have a master's in public health. And I'm running because I have 3 young children, and I want their world to be better than ours now. Thank you.
Hi, everyone. I'm Representative Ellie Hill. I currently represent House District 94 in the Montana Legislature. I'm running with the redistricting for the new House District 90. I'm the proud mom of 3 little boys, 9, 5, and 10-month-old Jackson, who you'll probably be hearing soon because he's teething. I'm also an attorney. I am probably better known to some of you as the former executive director of the Poverello Center, where I served as their longest serving executive director that they had. As I mentioned, I'm in my 3rd term. I'm on House Judiciary and House Health and Human Services, and so your issues are deep in my heart, and I have a lot to say about them because you, quite frankly, have a legislature that puts politics above common sense.
Hi, everyone. My name is Bryce Bennett. I am running for my 3rd term in the Montana Legislature. I currently represent House District 92, running for House District 91, which includes the Rattlesnake area of Missoula, downtown, and about half of the university area. I have spent my entire life working to empower young people in their democracy, and it's something I care passionately about. And I'm running for re-election to continue working on issues like protecting our right to vote, making sure that everybody's equal under the law, fighting for a well-funded and accessible education, and making sure that we can protect our privacy here in the great state of Montana.
I'm Susan Evans. I live up in Polson. I'm running for House District 93, which runs south of Polson all the way down to Arlee. I'm here because as a school teacher and the mother of 3, I'm concerned about jobs for our children so that they don't have to leave home to get a good job. I want our schools to be adequately funded so that our children are trained to take a good job when they get out.
Thank you very much, candidates. And candidates, please remember to keep an eye on those time markers in the back row there. One last note for the audience, please hold applause until the very end of tonight's forum. Please refrain from making any comments or noises, and remember we will have time at the end for questions from the audience. And with that, we will now start off with our first question. I will tell you who I'm going to ask the question to first. Everybody at the table is going to have a chance to answer the question, and then I will actually ask the question. So for the first question, we'll be starting off with Dick Haynes and then Diane Sands in Senate District 49, and then going down the table. The first question. The 2015 legislature will have another opportunity to address the issue of affordable health care for 70,000 very low-income Montanans. Most of these people do not qualify for subsidized coverage through the new federal health care insurance marketplace, so they have no source of affordable health insurance. Federal funds are available to pay for 100% of the cost of providing health coverage for these people at first, and decreases over time to 90%. 90% federal funding. Policymakers are looking at a variety of options to use these federal funds to provide health care coverage. Of the 27 states that have accepted the federal funding, some states are expanding their current Medicaid programs, while others are using a private insurance system as coverage. Do you think Montana should expand our Medicaid program or use another vehicle such as the private insurance system? Please be specific about whether you support accepting federal funds for this purpose. Mr. Haynes.
Thank you. I'll be quite honest with you, I haven't put much thought into this process, particularly as confusing as the health insurance market is right now. I'm a little leery about expanding the Medicaid program till we know more about what's going to come out of the federal government with there. I don't think we're anywhere near done with the uproar and potential lawsuits. If we do it, I'd like to know, when we start talking about this kind of money, what kind of money are we talking about in terms of quantity? I don't see much here that tells me what kind of funding we're talking about and how much. And I think we're going to get hit with some things here before we're all done with the Obamacare program. So at this point in time, I'm not ready to support this with using federal funds.
Madam Sands.
Thank you. Yes, I am a strong supporter of expanding Medicaid. I was supportive of the Affordable Care Act. I think it's in general done a pretty good job. There's some problem areas. But those 70,000 Montanans that are out there that are uncovered at this point are mostly working poor people. The poorest of the poor have help, and people who have good incomes have ability to access health care. You know, I ran the community health center here and have expanded them across the state, which were basically designed to help provide health care for people who really don't have other access to insurance or health care. I think this is a way to level the playing field to make sure that all Montanans are basically covered for their basic health care needs. And I think it's critical that we do it this session. We have an enormous amount of money on the table that Montana is not taking that's available in federal money, with a relatively small match of Montana funds, which would be well spent to provide this kind of care. The ripple effects are enormous. It affects everything from our hospitals and their ability to deal with debt to just general making sure everyone gets what they need. Thanks.
For Senate District 48, Mr. Hopkins.
I would absolutely not be voting to expand Medicare or Medicaid in Montana. I think that it will end up costing the state well over $100 million. It will make a very significant dent in our rainy day fund. And I think that Obamacare in general is a genuinely terrible piece of legislation that incentivizes business owners to fire full-time employees and hire part-time employees. And we are sitting in the university center at a university where student health insurance premiums have gone up by literally 50% in just a single year. I think that there's better ways of getting it done, and I would absolutely not be voting for it.
For Senate District 50, Mr. Facey.
Certainly, I did vote for expansion, and I would continue to vote for expansion. Obamacare came from the Heritage Foundation, which is a conservative think tank, with the idea was if everybody had health insurance, that there'd be better health coverage and better care. It's worked exactly as it's been asked to work. It's not confusing. The state has no rainy day fund, so you wouldn't be reducing that. the state would get $2 billion of money to increase medical care, $2 billion that will be paying wages and taxes. So any increase or state fund match is going to be paid for by the $2 billion we're going to get, because they're going to have to hire doctors and nurses and the like. I certainly would support Medicaid expansion.
For House District 92, Mr. Strohmeyer.
I frequently get asked while knocking on doors throughout the district what is my highest priority piece of legislation to accomplish should I be elected. And this is the one that I unequivocally say I would support. We absolutely need to expand Medicaid in the state of Montana. For many of the working class families who I hope to represent, Medicaid expansion would significantly enhance their quality of lives. As you already heard, it would increase to the tune of about 70,000 folks who would be covered within the state of Montana. Economically, it would have a huge impact, by some estimates, adding 12,000 additional jobs to the state of Montana, and at a point in time where we're constantly looking for ways to enhance the state economically, this is a chance to do both that and improve the quality of lives of our fellow Montanans.
For House District 98, we will start with Willis Curdy, followed by Roger Seawald.
I fully support the Medicaid expansion. As a classroom teacher, I fought long and hard for the Children's Health Insurance Program. I saw what the Children's Health Insurance Program has done for our kids. The same thing can be done with Medicaid expansion for our employees. A healthy worker is a productive worker. Economically, not only do we provide more jobs, but the folks who are working now can go to work with ability to have better access to health care and be more productive workers. On top of that, we see that hospitals in states where they have approved expansion now are more profitable, and they work at a more profitable and better rate of employment for nurses and other medical care employees. I think it's imperative that we do this, not only for our employers, employees, and for folks who work in the healthcare industry.
Mr. Seawald.
I've heard it said numerous times that expansion of Medicaid in the state of Montana really doesn't cost Montana anything, and that's not true. Most people in Montana pay federal taxes. That adds to a federal deficit, which at some point in time, the people here going to school are going to have to figure out exactly how that deficit is going to be paid. I would like to see some type of health care program for the people that can't afford it, but I don't think expanding Medicaid at this point is the option that we're looking for, because nothing is going to be free if we continue to raise deficits at the federal level. And as I think Dick pointed out, nobody knows what the real cost of expansion of Medicaid is going to end up being.
House District 94, Kimberly Dudick.
I fully support expanding Medicaid and worked towards that the last session. We had a good bipartisan group of individuals working to improve the health of Montana citizens by passing Medicaid, and we were stopped from doing that. The Affordable Care Act, and Obamacare as it is called, is the law of the land, and people think that stopping Medicaid from expanding is somehow going to reverse the Affordable Care Act, and that is just not factually accurate. What is happening is that we're seeing the health and the economics of this having a detrimental impact on Montana citizens and on our rural hospitals, because the hospitals are having increasing debt because they're not getting the repayment they would get if Medicaid was expanded. So what we're going to see in Montana is that rural hospitals in Circle or 2DOT eventually are going to have to close because they can't afford to operate if Medicaid is not expanded. In addition to that, as you've already heard some of the money that we're losing, there is $1.84 million of federal funds that we're losing every day. That's our federal tax dollars going to other states. So if we like that, we should keep not expanding Medicaid, and we'll keep losing our tax dollars. Also, there's $135,205 each day in potential state and tax local revenue that we could gain if we expanded Medicaid. Also, 1.3 million in labor income each day, as well as the 12,000 good-paying jobs we heard about. And the 70,000 low-income Montanans include 9,500 vets and their families, 20,000 American Indians, and 43,000 working adults. So we need to remember who would actually
Thank
be
you, Madam
benefited
Dudick.
by expanding Medicaid. Thank you.
Thanks a lot. I obviously totally and unequivocally support Medicaid expansion in the state of Montana. The folks you heard up here on the panel tonight that said that they would never vote for it represent the same right-wing obstructionists who stopped it during the legislative session. You know why? Because 27 states support Medicaid expansion. 9 of them have Republican governors, including Chris Christie in New Jersey, Jan Brewer in Arizona, not exactly shrieking liberals. And that's because I sat on the House Health and Human Services Committee and listened to testimony after testimony of those 70,000 Montanans. The Montana Chamber of Commerce supported it. Montana hospitals, Montana physicians, Montana small business owners. The only people that came in opposition were members of the Bozeman Tea Party. It's an abhorrent, partisan, and offensive vote that occurred last session, and I hope that we will fight for people that will pass it during our next legislative session. Thank you.
For the audience, that was House District 90, Ellie Hill. Next, House District 91, Bryce Bennett.
Thank you. I think that not passing Medicaid expansion was the great tragedy of the last session. I mean, for the 70,000 Montanans that could have had insurance because of the passage of that bill, it's not hyperbole to say it's a life and death matter. I mean, there's people who could have had regular doctor's visits and been able to go to the hospital and been able to take care of themselves for the first time in a very long time, who are going to leave that opportunity, who aren't going to have that chance because we were unable to get that done. And it was bipartisan. It was a strong effort by a number of people to get that passed. I mean, the number 70,000 is definitely put up there. But the other piece that I think is important to say is that if we were to expand Medicaid, it was put out there that it was likely that we would create 12 to 15,000 jobs here in the great state of Montana because of that. And I think that's a hard thing to turn down in the process. So people having jobs, people having health coverage, that's the result of Medicaid expansion. That's the reason why I was a strong supporter of it in the past and will continue to be a supporter of it in the future.
And last, House District 93, Susan Evan.
I also support the Medicaid expansion. I actually feel that it was criminal of the previous legislature to turn it down. 70,000 people are now uninsured because of that vote. 70,000 people's lives are at risk. I spoke to one legislator who said that they were trying to be fiscally responsible. My answer to that is, you can be fiscally responsible as long as people's lives are not at stake. If people's lives are at stake, then you find the money. I don't care where or how, you find it. And you make that happen because people need it. Our hospital in Ronan, the St. Luke Hospital, administration was all geared up and ready to go, boots on the ground when it passed, and then it didn't. And when I spoke with the administration, they were upset. They had prepared, they were ready, they were excited, they wanted this to happen. If the hospitals are excited and the people are excited, then it's time for the legislature to get behind it.
Thank you, candidates. Now for question number 2. Many policymakers believe that our Medicaid program needs improvement. What proposals do you support for improving or reforming Medicaid? We will start this off with House District 98 with Roger Seawald and then Willis Curdy. Mr. Seawald.
I can tell you right now that people struggle with health insurance and health care, and I understand that. I would like to see, I'm not saying, and never did say that I wouldn't vote for the expansion of Medicaid, but I think that we need to be able to figure out how we're going to actually fund it, and that's my biggest concern, is being able to fund things at the state level. We may have to give up on some things that have been happening on a regular basis through the state. But if the funding can be found, I would support it, and I can tell you that the reforming may have to deal with some additional, if people want it, some additional taxes within the state, and they need to understand that.
Mr. Curdy.
I think one thing that can be done to help the Medicaid issue is deal with physician reimbursements. It's been a major problem down through the years. Here in Missoula, we don't have a big problem with doctors rejecting Medicaid patients, but we do have to pay close attention to make sure that, you know, those physicians in this state have to or should be ready and willing to take those patients. I think that's one thing that's important. I guess that's it for the time being.
For House District 93, Susan Evans.
Thank you. I think it's possible that we can fund this if we close just one loophole, one tax break that benefits a few people, and we can close that loophole and make benefits for 70,000 people. Thank you.
House District 91, Bryce Bennett.
I think the answer to this question is just as similar to the last one. I mean, Medicaid expansion is a huge piece of what we need to do around this issue, but I do think that Willis Curdy really touches on something that's important, and that is the reimbursement rates that we have for our doctors. I mean, when I've traveled around the state and talked with doctors, especially in rural areas, I mean, they find it very hard to be able to, you know, accept Medicaid payments because so many of the people who are requiring their services are Medicaid patients, and the reimbursement rate is so much lower than they would get from private insurance that it makes it really hard for them to continue to accept Medicaid. So doing whatever we can to provide those services to people and making sure that that Medicaid expansion, Medicaid expansion is done, but the reimbursement rates are ticked up to make sure that doctors are able to bring on as many patients in need as possible, I think is a big piece of it, especially for rural Montanans.
House District 90, Ellie Hill.
Yeah, hi. I concur with what was said about reimbursement rates for doctors. I also would like to share that, you know, our own Democratic Governor, Steve Bullock, who I'm a huge fan of, I did vote to override his veto of House Bill 12. And for folks that didn't know what that was, it would have provided increased rates for the providers of those who care for the people with disabilities. There's a few of our Democrats that voted to override that. I also would like to say Medicaid be increased to compensate those with mental illness at a higher rate. I want to share, though, because I have the time here, that the biggest obstacle in this discussion in healthcare in general, and a few issues that we're going to talk about here right now, is the amount of unlimited money in politics. The Koch brothers, ALEC, the American Legislative Exchange Council, and what I mean by that is big business and big pharma is coming in and controlling a lot of these debates and training legislators in all 50 states now to basically represent their interests and not the interests of the people of Montana and the people of our country. So I hope folks will keep their eye on, if they care about these issues, on that issue. Because to me, it's perhaps not as sexy as it should be, but it is the #1 most corrupt issue from what I've seen in the legislature.
House District 94, Kimberly Dudick.
And I agree with what's been said about the reimbursement rates. We've heard about that as one reason people can't get into a doctor is they don't accept any more Medicaid patients, and a lot of that is because of the low reimbursement rates. So we need to look at that, and we also need to look at improving the number of providers in general in Montana. We did that last session by improving the WWAMI slots as well as the residency slots, but we really need to look at how do we give health care to people in rural communities in a way that is accessible to them. So we need to make Medicaid as accessible as possible, people as easy to use, and make sure it provides the services they need. Another thing we need to do is invest more in prevention, and we need to give people incentives to do that through our Medicaid system. So that needs to be explored more rather than waiting for health problems to occur. We need to look at how we can prevent those and give people healthier lives. And a lot of the Affordable Care Act has done that, but we need to do more on a state level and examine how we can do more for our citizens.
House District 92, Dave Strohmeyer.
Lest I not have an opportunity later, I want to thank all the organizers for tonight's event. This is an important topic, a timely topic, and I'm thankful to have the opportunity here to chat about health care. How might we reform or improve Medicaid in the state of Montana? I would say first and foremost, and this is my general philosophy of governance, I want to listen to those who are in the trenches trying to figure this problem out. I'm not going to blow a bunch of smoke here as far as having all the answers tonight. Certainly we've heard a few of them that I would concur with as far as physician reimbursement, looking for those impediments in terms of physicians taking new Medicaid patients. But at the beginning and the end of the day, I want to hear from those who have familiarity with this and take their lead and see what I can do to help out.
For Senate District 49, we will begin with Diane Sands, to be followed by Dick Haynes. Madam Sands.
Thank you. I concur with a lot of what's been said. This is not a new discussion. You know, I've been around the legislature for about 40 years as a lobbyist first on behalf of families and more recently as a legislator. And the discussion of expansion of Medicaid and how to provide Medicaid services is one that the legislature has tried to deal with for many years, and mostly with a little bit of tinkering. And until the Affordable Care Act, there was really no serious way to talk about expansion in a broad way to really cover the people who need it. My work with the community health center system, both directing one here in Missoula and carrying funding to expand those by 3 in the state, has really given me a perspective on what it takes to be able to provide health care, particularly to the working poor. And there are many barriers to that. And one of the biggest really is that we have got to move from treating illness after the fact to prevention. And so I think trying to figure out how to direct Medicaid funding and Medicaid programs toward prevention is really critical. Secondly, we have to deal with medical bankruptcy, which is killing many people in our state. I worked with hospitals to provide additional funding on debt relief for hospitals for patients. We need to continue to look at that issue as well. Thank you.
Mr. Haynes.
I think the question of how to fund health care, any aspect of it, is going to be a huge question. I don't think we're even on the edge of feeling the impact of that. So any reforming of Medicare will be dependent on the dollars available, because change or improvement will certainly cost more. I think the biggest health care problem we have in this state right now is mental illness. Our prison, 50% of the people there are healthcare, are mental problems, and the same thing goes many other places in our daily life. If we're going to put more money into health care, I think it should go toward hiring more people that work in the field of mental health.
For Senate District 50, Tom Facey.
Thank you. I think we should move away from a fee-for-service model, which is more like an assembly line where you get paid for what you do, the doctor does, and move towards a capitation model where the doctor or the health organization gets paid for keeping the individual healthy for their lifespan. A great example of that would be managing diabetes. In a fee-for-service, you just manage the episode right in front of you. With a capitation, you manage the disease, so in theory and in practice, you can reduce those incidences which are, I don't want to say tragic, but which are spontaneous and expensive, and help manage the disease. And that's why the expansion of Medicaid would have worked, because you've gotten more patients under a clinic where their health in its entirety would have been addressed, and not just at the emergency situation. So we have to move away from that fee-for-service model and allow the hospitals and clinics and doctor groups to work on the entire health of the individual and the health of the population. That'll drive down our costs. So let's move away from the fee-for-service into a different model. Thank you.
And last, for Senate District 48, Mike Hopkins.
First, just because it's a personal pet peeve of mine, when individuals like to mention the individual mandate and say that it comes from the Heritage Foundation as a way to justify it, I would just like to point out that all that proves is that both parties are more than capable of coming up with really bad ideas. One of the nice things, or bad things, depending on how you look at it, is being at the end of a panel is that you usually hear everybody say the good ideas that you were thinking of ahead of time. And whether it's physician reimbursement or anything else, I don't really know what else to be said. I certainly do not have a plan that fixes Medicare by itself.
And on to question 3. As you may recall, Montana reached a legal settlement with the tobacco industry and now receives $30 million per year from the tobacco companies. In the 2002 election, Montanans voted to use about one-third of the tobacco settlement dollars to fund tobacco prevention, including programs to prevent kids from smoking and to help smokers who want to quit. The Centers for Disease Control and Prevention recommends that Montana spend at least $14.6 million to support these important tobacco prevention programs. The question: do you favor or oppose continuing to use this portion of the tobacco settlement revenue to fund tobacco prevention programs? On what basis will you decide funding for programs such as these? We will start off with Senate District 48, Mike Hopkins.
I mean, I don't really know how this requires all that long of an answer. Yes, I would support continuing to use these funds to prevent young people from smoking.
Senate District 50, Tom Facey.
I too would support the continuation of the use of those funds.
Excuse me. Senate District 49, we will start with Dick Haynes, to be followed by Diane Sands.
The question I have is, how effective are we now? Haven't seen anything talking about any kinds of estimates of number of youngsters that have quit smoking or haven't tried smoking. What are we talking about? Is 14.6 that all that we're putting into it now? Is it being spent effectively? I have no idea. If I get to the Senate, first thing you do with something like this is have a hearing and call in some experts and ask them to explain how effective the program is now before we start talking about whether it needs to be expanded.
Madam Sands.
I do support this model. I think using, as we call them, sin taxes to support prevention services has been a way that we have provided everything from drug and alcohol prevention programs as well as smoking. I think they generally are quite effective. I think we should look at this as a model for maybe expanding, God help us, the tax on alcohol, because I think our other great problem we have out there is alcohol prevention work that needs to be done, particularly with young people, so that we don't have as many problems with alcoholism and young people that end up dead or in deep trouble and our institutions having to pick up that bill. But I do support the use of the tobacco tax. I think that's been an extremely effective model, and I think we should all get behind it.
For House District 92, Dave Strohmeyer.
I remember as a kid, when Father's Day rolled around, at least on one occasion, I remember purchasing my dad an ashtray. I thought that was a great idea. Dad was a smoker, and that would be something he liked. Well, 25 years ago, in 1989, my dad died a long and painful death of lung cancer. And I would say, without a doubt, anything that we can do to prevent a preventable death like that is something we should invest in.
For House District 98, we will begin with Willis Curdy, to be followed by Roger Seawald.
I would favor continuing the program.
Mr. Seawald.
See, we can reach some agreement up here. I think we should fund the program, and I think we should decide on additional money based on where the success rates are and where the heaviest use may be. That's where the dollars need to go. Thank you.
For House District 94, Kimberly Dudick.
I would also support continuing the funding for these programs. I think it's important that we focus on prevention, and that would be an appropriate use of this money, is to prevent smoking and use the money for what it should be used for, is preventing smoking. Health problems related to smoking are a huge burden on our society, and if we can prevent those from occurring, it would be a good use of taxpayer money. As far as the second part of this question, which is on what basis will you decide funding for programs such as these, I think we've heard a little bit of that. Yes. I think that using evidence-based models are a good way to decide what we should do in prevention, and we need to look at what programs are effective when we use our money and we invest our public funds in those, and we should do that when we're looking at tobacco prevention. I think that it'll make healthier communities in general, and then we should focus on that.
For House District 90, Ellie Hill.
Thanks a lot. Yeah, I continue to support continuing the use of this type of money for tobacco prevention. I'll share with you that not only have I offered unfettered support of the Cancer Action Network, who are one of the group that's here today, I can tell you that the 12 million Americans that live with cancer are not Republicans or Democrats. They don't care if you voted for Obama or McCain. But yet, when it gets to the legislative session, it is some folks that really attack the use of this money. In Montana, I learned through my role on House Health and Human Services that we have one of the highest smokeless tobacco rates in the country. Cowboys get cancer too. College campuses, it's been up since 1993 from 22 to 28%, now up to a third of all college kids smoke. This is a huge problem in our country. So I would continue to support at the federal level cancer research. I continue to support at the state level our sin tax funding, tobacco control programs, prevention. And then again, I'm going to harp on Medicaid expansion so that the access to the care for cancer patients can get the help they need. So thank you.
For House District 91, Bryce Bennett.
Yeah, I really strongly believe in keeping this money here and making sure that we can continue to fund these tobacco prevention programs. You know, the effects of smoking and the use of tobacco has long-term effects, and the earlier that we can connect with young people and let them know about what that life is going to be like for them and the long-term medical effects they're going to be in their lives on a consistent and everlasting basis, the better it can be. So providing that funding to make sure that gets done is incredibly important. And the way that I would assess what funding goes into these programs is really basic. Is it effective? Is it getting the job done? Are there tangible things that we can see and outcomes from the work that we're doing on these things?
For House District 93, Susan Evans.
I started smoking at 17. I quit at 30 after 2 years, and 2 quit smoking clinics of a week each, one by the American Cancer Society and one by the American Heart Association. In those clinics, I learned that quitting smoking, according to heroin addicts, is harder than quitting the heroin habit. I think that prevention is a much better option than curing. I think prevention is a much better option than trying to spend 2 years quitting, and a husband who died at 60 because he did not, a brother who died at 66 because he did not, and that was not a happy thing for my life. It was not happy for my children. And I agree with the smokeless tobacco thing. I have a personal friend who now has no voice from chewed tobacco. And we need to be proactive and not just floundering around. We need to research. We need to protect our children.
And now for question number 4. This question is on behalf of the Associated Students of the University of Montana. Many students in the Montana University system have come forward with concerns regarding the quality and the access to mental health care. What actions would you take to provide qualitative and quantitative mental health care to young adults or low-income families? We will begin this with House District 90, Ellie Hill.
Yeah, so mental health care is one of my it's one of my highest priorities. It's actually the reason I ran for the legislature. When I served as the deputy prosecuting attorney, I saw that our criminal justice system was filled with 2 types of people. Those that were mentally ill had co-occurring disorders, mental illness with substance abuse and or generational poverty. Their mom or dad had been in prison and now they're in juvie. Then when I went to the Poverello Center, I saw that not only did it truly house the mentally ill or house the homeless, but that our state mental hospital in Warm Springs was actually discharging patients directly into homelessness. There's nothing that I'm more passionate about or believe that we can do make such a difference about than this. On House Judiciary, I watched the NRA try to put guns in banks and bars and schools, and then attack the mentally ill for these killings in schools and high schools across the country. A provision of the Affordable Care Act would have allowed parents to keep millennials on their insurance. This would have had a huge effect in Montana for millennials and their access to health care. Last session, NAMI gave me the 2013 Legislative Hero Award, and that's because if we don't pay for mental health care now, we pay later. We pay in emergency rooms, we pay in community hospitals, and we pay in law enforcement agencies and correctional facilities. So please continue to fund mental health care in our state.
For House District 91, Bryce Bennett.
Thank you. Mental health is a huge issue in Montana. It's something that I care incredibly passionately about. You know, I traveled around with some of the other Democratic leadership in the state to talk with people in every corner, business owners and hospital managers, and everywhere that we would go in the state, they would tell us that the one thing that kind of connected all these communities together was the need for more support and funding for mental health. And I'm really excited that ASUM brought this forward because it is something that we are going to have to address in the next legislature. I mean, especially as we see all around us these tragedies that happen time and time again because people were not getting the care they needed, and whether it's they take out violence on other people or they end up taking out violence on themselves, we find ourselves in a really tough place because we're not addressing something that is so desperately needed. You know, I care passionately, perhaps more than anything else, about suicide prevention. You know, it's something that has touched my life, and it's something that I've seen touch far too many lives in our state. I think that we have some services right now, but there's much more that we can do, and I'm going to work in the next legislature to find programs that currently exist or new opportunities to reach young people and make sure that they are being treated at an early age and addressing their concerns before we get too far down the road and before they're too far gone. So I will be addressing this issue.
For House District 93, Susan Evans.
I'm currently serving on a task force to address homelessness among youth on our reservation. While we have had several meetings, a lot of information has come out about our homeless youth who are homeless simply because of family dysfunction, families who the parents are themselves drug addicts or alcoholics, and the children, rather than stay in that environment, will run away. And they will live on somebody's couch until they get thrown out, and then they'll live on another couch until they get thrown out. And this is a serious epidemic, not just on our reservation, but it's an epidemic across the country. The one thing we're finding is that these kids don't have any place to go to get counseling, to get advice, to get homes, to get clothing or food or anything. And it's important that we address this mental health issue because they're the ones that are going to grow up into dysfunctional adults if we don't take care of this now. Thank you.
Senate District 48, Mike Hopkins.
I think it's a great question. And I think when you're looking at young adults, particularly college students, you would hope that there would be something like the Curry Health Center here on campus capable of providing more services than they currently do. It's rough for Curry because its budget has been getting hammered really badly as one of the unforeseen consequences of the Affordable Care Act. I think short-term, injecting more money into services like Curry, allowing them to provide more counselors and more counseling sessions to individual students would be a good place to start. That unfortunately doesn't take a big crack out of low-income families, and so you have to be able to think of a multifaceted approach.
For Senate District 50, Tom Facey.
Thank you. I think this is a tough issue, and I don't know enough about it, but I should for a number of reasons. I think we want to probably expand our community-based mental health. I think we probably want to get our judicial system involved and allow the judicial system to adjudicate if there's a mental health issue involved. I think we probably need to intertwine the mental health system and substance abuse because those two probably go together, and then I'm also thinking about prescription drugs in that. I do know in some communities, in some areas, we do have a duplication of services. We've got competition in not a good sense on some of these mental health services. But again, thanks for the question.
For Senate District 49, we will begin with Dick Haynes, to be followed by Diane Sands.
A couple of observations I've made about this particular problem. I hear some time back. It's been a couple of years. I had about a 2-hour discussion with Senator Facey's wife. She's a very intelligent, hardworking professional in the field of mental health. And I was overwhelmed with how big the problem is, particularly for lack of staffing to deal with the problems. And another hour or so talking to the warden from the Montana State Penitentiary brings home how big the problem is there. Half the people there have got mental health problems and or drug problems, most of the time both. And I know that the tribes are going through hell on earth in some cases with this. I think the best thing we could do, and I mentioned it earlier on another question, I think it's one of our most serious problems. And for all the money everybody wants to spend wherever and throw the money at any problem on the wall, I think we do need to put more money into mental health and hire more mental health professionals. Thank you.
Madam Sands.
Yes, like most Montana families, my family has its share of people who have mental illnesses. I have a cousin who committed suicide, alcoholism abuse. This is a problem that affects all Montana families, not just low-income families or those people. And partly because of that, I've been very involved in things such as serving on the State Mental Health Oversight Committee, and in terms of my legislative work, I was the House sponsor for the Montana Suicide Prevention Act back in 2009. We have a lot more work to do because we don't have adequate community-based services, and I think we haven't really decided on models that we think will work best. It's one thing to provide those services in Missoula in a larger community. It's another thing to try to provide them in rural eastern Montana where I grew up, where for quite a long time we didn't have a single psychiatrist east of Billings in private practice. The money that it takes to make sure that those services and those providers are out there and willing to take those jobs and be able to function is a huge problem in the state. So there are many ways to start approaching this. They're all intersecting each other, but it is a top priority for the legislature in many ways, whether it's dealing with corrections, dealing with human services, or how we spend our money. And I will be working on that topic. Thank you.
For House District 92, Dave Strohmeyer.
Here about 2 or 3 weeks ago, I sat in this room for a suicide prevention summit and learned at that point in time that Montana has the notoriety of having the highest suicide rate in the entire nation. That is outrageous. So it's a great thing that Montana's budget has been in the black, that we end our legislative sessions with a surplus. But if we're cheapskates in the process and fail to appropriate enough funds to turn us around on this particular issue, whether it's suicide prevention specifically or mental health more generally, I think we have failed to do our jobs as public servants and legislators. This is a multifaceted, complex issue. I serve on the Missoula County Public School Safety and Security Task Force. Got on that committee following Sandy Hook. And besides the infrastructure issues and training issues related to keeping our kids safe, we identified mental health as another huge issue that we need to address within our school systems. So I think certainly more money aimed at these programs that deal with mental health issues, looking at ways in which we can get more mental health providers throughout our communities, particularly in rural Montana, is critical.
House District 98, we will begin with Willis Curdy, to be followed by Roger Seawald.
Well, Dave, you stole my thunder about the unfortunate distinction of Montana being number one. But as a classroom teacher of 30 years, there were numerous occasions where students were on suicide watch. It was a yearly problem. And the school districts didn't have the resources early on in my career to deal with these issues. But in time, the schools came up with money to hire psychologists, psychiatrists, and the like, but still not enough to deal with the issues that the school districts faced. So that is one area where we need to really put some effort into. I would like to see the state work at maybe forgiving or reducing the loans on graduating mental health students are graduating from schools of psychology, psychiatry, so they can work with our students. And maybe in the next question, I'll have maybe a possibility how we can pay for that.
Mr. Seawald.
Well, Willis, you and I are in agreement. And I had written down here, and this goes along with question 8. I'm not trying to jump ahead. I'm just saying that they kind of go together. And statewide, we need to look at opportunities that we can provide graduating health professionals to come to Montana and work and help them reduce their student loans. That gives us some good people coming in here, some young, some aggressive individuals that want to work, who want to provide health care services, and it gives them the ability to reduce their student loans over a period of time. And I think that's one way that we could get quality people. I'm not sure how it would be funded or how much it would cost, but those are all things that can be worked out in the long run. Thank you.
House District 90, oh, sorry, I apologize. House District 94, Kimberly Dudick.
Thank you. I think we need to measure the problem. It sounds like we were talking about a lack of quality as well as a lack of quantity when we first read the question. And I think if we're looking at a lack of quality, we need to see if the training needs to be improved and the licensure that is going along with these professionals needs to be revamped. And if it's a lack of quantity, I think we've heard about what we can do. We can increase loan repayment opportunities and figure out other ways to make healthcare an affordable field for people to go into. In my work as a registered nurse, I saw firsthand the trials that people go through when they're in crisis. I worked with people who are in mental health commitments. And then as a deputy county attorney, I actually did the other end of that, and I helped do involuntary commitments to ensure that people were in safe settings where they couldn't harm themselves or others. One tragedy that we saw was one case where we all thought the person was fine. He was a young man. He actually then went home and hung himself. And it just reiterated for all of us that no matter what we do sometimes, we can't stop somebody from hurting themselves, but we should be able to provide mental health services that will detect that kind of a problem. We can do that by ensuring adequate funding, which I've worked for on appropriations to ensure that we have funding in our and through DPHHS to provide suicide prevention in our jails. That was one thing we did. And we also ensure that there's enough workers who can deal with these problems for children. And that's something I'll continue to fight for when I'm back in the legislature.
Thank you, candidates. Now for question number 5. It has been 9 years since we have increased the tax on all tobacco products. This increase helped to reduce youth initiative, I'm sorry, you're going to have to explain that one to me. Youth initiation? Yep. Okay. Help to reduce youth initiation and provide new revenue to state for funding access to care programs. Would you favor or oppose increasing the per pack price for cigarettes with an equal price increase on other tobacco products by using the state tobacco tax with the revenue dedicated to funding programs to reduce tobacco use, particularly among kids and other healthcare programs in the state? Please explain. We will begin this with House District 98. We will begin with Roger Seawald, to be followed by Willis Curdy.
I do like going first, so. Yes, I would increase the taxes on all tobacco products. I would support that. I will say I smoked for a number of years, and when my son was born, I quit. I couldn't afford both, and I think I made the right choice. So I guess when I am in certain areas of the city or in the county and I see very young people smoking, it disturbs me. Enough where I'd like to make tobacco products nearly inaccessible because of price for those individuals. But some of that has to revert back to their homes too. Their education needs to happen at the home level with the parents. So anyway, yes, I would support the increase.
Mr. Curdy.
Yes, I would support the increase. Now, other folks here at the table will yell at me about my solution, but in relation back to the previous question on mental health. The question asks, particularly among kids and other mental health or healthcare programs in the state. I'm kind of giving myself away here. You know, we talked about 1/3 of this tax going to prevention. Maybe, I know this is, Diane tells me it's been a fight in the legislature, but I think we need to seriously think about taking part of it and use it for mental health care. That might be a way to fund some of this. Now, I probably need more money for mental health care than what this tax might provide, but it's an idea. And that's what we're sorely in need of, folks, is ideas. So, for my 50 cents worth, that is.
Senate District 48, Mike Hopkins.
I don't know, because we haven't heard the rest of the panelists, but I may be the only person here that would not favor increasing the tax on tobacco products. I may not necessarily agree with increasing the taxes on them in the first place, but that's done. I do think that there's a point, however, that you cannot tax an individual out of making bad decisions, and it's not fair or right, in my opinion, to use the tax code for that purpose. You may very well not like a legal business and what that legal business does, and I smoked for a little over 10 years. It was pretty terrible for me, and I've known people that have died from lung cancer. But you can't use the tax system to force individuals to make decisions. I just think that that's going too far.
For House District 93, Susan Evans.
That's an interesting observation. You cannot prohibit things by raising the price, but you can use that fund to take care of all the other incidentals that come along with tobacco use. Healthcare is basically shot if you're a smoker. Your breath stinks, your skin deteriorates, your lungs rot, your heart works too hard. All of it comes together. And my question was, it's been 9 years. Why haven't we raised the tax sooner? In small incremental levels, so that it's not quite such a shock to the system, and then people start squawking, you've raised the tax too much. We've run into a problem similar to that over water rates in Polson, and that's people are squawking because now there's a huge rate increase and they don't know how to deal with it. 9 years is a long time to go without raising a tax. I think that's astonishing. Thank you.
For Senate District 50, Tom Facey.
Thank you. On question number 4, we related to, or 3, pardon me, talked about the CDC wanted 14.6 million would be a good program. We're now using approximately 10 million. So I'm assuming that the increased tax would make up that gap, and yes, I would support raising the tax.
For House District 91, Bryce Bennett.
I remember back in 2004, it was primary election day, and they sent a couple of us young canvassers down to Butte to collect signatures on a ballot initiative that would increase the tobacco tax on cigarettes, much like you're proposing here, to provide for the Healthy Montana Kids program. And one of the moments I remember the most was when a guy who had a really deep, scraggly voice and had a pack of cigarettes in his pocket came up to me and the other canvassers and was one of the first people willing to sign that petition, because he understood that the life choices that he made were not the ones that the next generation should have. And it was pretty inspiring to see him take that upon himself, because he understood how important these programs were. So I definitely support an increase in the tobacco tax. I think that more funding for these programs will lead to fewer people starting smoking and starting using smokeless tobacco, and the more of that we can have, the better we'll be as a state.
For Senate District 49, we will begin with Dick Haynes, to be followed by Diane Sands.
Yes. I think we should use every nickel we can find and from taxes on tobacco to reduce tobacco use, especially where the young people are using it. And this may sound kind of harsh, but I can't conceive of any tax on tobacco that I wouldn't support. As far as I'm concerned, tax it into oblivion.
Madam Sands.
Well, I think it's interesting that we talk about the use of the incredible cost for mental health services and healthcare services, and yet we primarily are talking about the use of sin taxes to pay for those rather than looking at general revenue funds to support some of these services, which I think we do need to do. I would support raising this tax, certainly, but I think there are in these other healthcare programs, violence prevention, which has now reached, thank God, the public's attention, I think, mental health services and other kinds of things. I do think within the next 5 years, I'll leap into this, I do think marijuana will become legal as a recreational drug, and I do think that the taxing of that will be the next major amount of sin tax money that will be on the table for use providing for educational services and to meet some of these needs if we look at what's happening in the other states. And it does come with its problems, but we'll offset that hopefully with some of the taxes that will be raised by doing it.
Reminder to everybody to please refrain from applause or comments. With that said, for House District 90, Ellie Hill.
Apologies, Mr. President. You know, I just couldn't, as you could see, concur with Representative Sands enough. You know, listen, I am not going to say right now whether I'd support increasing the sin tax for tobacco use. Obviously, I want to see more money put in prevention. I'm just concerned that these types of taxes have a greater effect on low-income Montanans. We know that 3 times more low-income folks use tobacco in Montana. Nationally, 34% of low-income folks use it, and only 13% of those who make over $90,000 a year. I'd like to see a little bit more before we go and tax tobacco use, how it would affect, of course, the elderly in Montana and also Native Americans. With that, I couldn't agree more. If we wouldn't have had the debacle that occurred in the 2011 session with medical marijuana, we could join the myriad of states who have used the tax from their marijuana to fund these types of programs.
For House District 92, Dave Strohmeyer.
Tobacco use is a classic case of where we have essentially privatized the benefit of being able to do whatever the heck we want to do, but socialize the costs. So we all pick up the tab through increased insurance premiums, the social costs of kids losing parents to cancer at an early age, and the costs that those individuals who suffer health effects, ill health effects from use of tobacco suffer themselves. So yes, I would support increasing taxation on tobacco products.
For House District 94, Kimberly Dudick.
Yes, I would definitely support increasing the tax on tobacco products. Studies have shown that an increase of 10% has a decrease in overall cigarette consumption by 3 to 5%, and this is especially effective on young adults and children. It's about 2 to 3 times more effective for stopping them from initiating cigarette use. So if we really want to have a healthier society and we want to prevent health consequences associated with smoking, we should invest in prevention. I also believe that we know that there's a large cost to society. We've heard about that somewhat. From 2009 to 2012, we saw about a $300 billion cost to our society. That's in medical care, also lost worker productivity for the smoker, but also from secondhand smoke exposure. So even though you're not smoking, if you're around it, you're going to suffer the health consequences and the loss of economic benefit from not being able to work. So we need to stop people from smoking, from starting to smoke. We've heard how hard it is to stop. So we should invest our money in stopping people from getting these health problems and developing such poor habits. Thank you.
And now for question number 6. Exposure to UV radiation through sunlight and indoor tanning devices is one of the most avoidable risk factors for skin cancer. Since 1998, teens across the country reporting the use of tanning beds have increased from 1% to 27%. Will you support a law which prohibits the use of indoor tanning devices for everyone under the age of 18? We will begin this with House District 93, Susan Evans.
This is kind of a catch-22. There's some small evidence that tanning or sunlight exposure actually increases your mental health. I see a lot of the teens that are getting their tanning beds preparing for the prom. So it's like I say, it's a catch-22. Yes, it's a bad idea for young people to be tanning because they are more susceptible, but I'm not sure that this is the way to go about dealing with that.
House District 91, Bryce Bennett.
This is really an interesting question, one I had not thought about until earlier tonight, and I was talking with some of the people around me because it seems like this is a newer issue, and I was shocked by the amount of young people who are using it. I know personally that somebody mentioned the prom, you're the only one person who's spoken before, mentioned the prom, and I remember my sister, before her prom, went to the tanning bed many, many times, and she, being my sister, had a very dark complexion by the time that she got to prom. So I think there is a problem with people who are using it a great deal. Whether to ban it, I would love to see some more information. But I will tell you that a lot of young people think they're immortal. They think that they're not going to have skin problems or skin cancer. But I remember when I was 14 and one of my friends, when we were out hanging around, noticed that a mole at the top of my ear started having some weird edges, and I ended up having a chunk of my ear cut off because they thought it was going to be cancerous. So even at the age of 14, there were some real concerns for me. So I know that this is something that definitely needs to be looked at.
For House District 90, Ellie Hill.
Thanks a lot. So yeah, I actually heard this bill both in the 2011 and 2013 session. Senator Kim Gillen out of Billings carried it first, and then this last session, Representative Frankie Wilmer carried it. It was, I know this sounds strange, but it was truly one of the offensive hearings I've ever seen. Everybody from Montana Physicians Association, hospitals, MACO, which is the Montana Association of Counties, everybody came in support of this bill, and it was only, again, the lack of common sense and partisan divide that killed this bill. I will tell you that college and teenage girls are the most vulnerable for skin cancer. It's easier in the state of Montana to get a tattoo than expose yourself to skin cancer. I tried to amend during the hearing on this not to prohibit the use of indoor tanning beds for everyone under age 18, but at least minimally to ask for a parent permission. That, of course, didn't even pass. The very idea that a 14-year-old or 12-year-old could go and repeatedly expose themselves to UV rays just boggles my mind. You should know that 37% of white young adolescents will use a tanning bed in their life, 11% of men, and 12 million Americans have cancer. To allow partisan divide to overrule common sense bills like these is offensive. And you should know, by the way, the majority of states in this country do have laws in place right now that at least provide some oversight for folks under 18 using tanning beds, not Montana.
For House District 94, Kimberly Dudek.
And I'm not certain if I would support a bill which outright bans this. I think we'd have to hear the testimony from experts as well as hear what other states have done and how effective it is with reducing skin cancer rates. But I do think that having a parental notification form and permission slip seems reasonable. We need to have parental permission for so many things. And then you would think if somebody was exposing themselves to an unhealthy situation that their parent should at least be notified and have to approve of that, especially when the child is not able to appreciate the consequences of their actions. So there should be some sort of oversight. As far as that should go, I'm not certain yet. But I do think that our children need to be protected and the adults in our society need to be the ones doing the protecting.
For House District 98, we will begin with Roger Sewell, to be followed by Willis Curdy.
Yeah, on the face of it, I don't think that I would support a law. I agree that parental review of it ought to be involved, but outright ban it for 18-year-olds. I mean, so you're 18, so at 19 you're okay and you're not going to get cancer. You're 21, you're not going to get cancer. I think there needs to be some, not disclaimers, but there needs to be some advice at the tanning salons that talk about the risks. There need to be some warnings. And for someone under 18, I would agree that some parental oversight needs to be involved.
Mr. Curdy.
Well, there we go again, agreeing on something, Roger. Okay? You know, from my experience, I've in the last 4 years have had 2 surgeries for removal of basal carcinomas. One last year was a reconstruction of my nose. Some would say the doctor didn't do a good enough job, but that's beside the point. But anyway, this came from not taking care of myself when I was a teenager. And I would have a problem banning, supporting a ban on the use. But I do agree that some parental control is in order. But the other thing is we also need to pay a lot of attention to education of our young kids about the use of tanning beds. And it is a part of a health curriculum, and I think it's something that should be addressed at that point.
House District 92, Dave Strohmeyer.
Well, having a natural golden bronze complexion, I haven't thought about it too much over the years, but no, in all seriousness, this is probably the first time I had heard this issue articulated as it is here, and I would certainly want to hear both pro and con on both sides of this issue before I resolved in my own mind whether I supported this or not.
For Senate District 49, we will begin with Diane Sands, to be followed by Dick Haynes.
Well, the larger issue here, I think, is one that I hear the uncomfortableness or the balancing among all of the people at the table, which is really, how far should government go in prohibiting people from doing something we know is going to harm them versus their both right to do that behavior, whether it's harmful or not, or I would argue putting our resources into education as a major strategy for creating change versus just banning something. I think if you look at why reducing smoking has been so successful, a lot of it's been health education. How about unprotected sex? Health education. There's so many areas where what we really need to have is an educated populace, particularly health education in schools, about all of the various things that go to creating a healthy lifestyle, not just all the dangers. And I would say in this area, that's one of them, is we need to be working particularly with young girls about why do they think it's beautiful to be tanned to oblivion. We need to be addressing some of the gender stereotyping related to that. I mean, I would probably vote for this, but overall, you can't solve all the problems of the world by just making things illegal. You've got to really invest in health education.
Mr. Haynes.
Thank you. I'm kind of like, I've got mixed emotions over this. I don't know how you effectively limit the use of tanning devices. I just have some personal experience that makes me think there's a real health issue here. My first hat was one that was issued to me by the U.S. Army. Since before that time, I didn't do much in the way of protecting myself, so I still have a program of almost continuous once a year removal of small cancers on my face and head. I think use of tanning devices will come back to haunt you. I see, it isn't so much kids, I see a lot of older people, particularly women, that look like a dried prune because of continual use of the tanning business. I also managed a swimming pool in Helena for several years, and the thing was then, since they didn't have the protective bombs now that can be used to prevent sunburn, but the lifeguards would sit out there all day long, and they'd rub baby oil with iodine in it on them to make themselves have that color, and they'd sit out there, and of course their hair would turn blonde from sitting in the sun all day. Well, recently we just had my 60th high school class reunion, and some of those people are no longer with us. And a little inquiry as to what happened to them. It looks like that happened to them, that they just, they picked up some skin cancer along the way, melanoma. And I got to believe that was due to sitting on that poolside, doing their duty, but also trying to get a good tan out of it. That's all I can say to people.
Mr. Haynes, just keep an eye on the time, please, sir.
I'm sorry. Be very careful with that. Sorry.
Thank you very much. For House District 92, Dave Strohmeyer.
Do I need to take another shot at that question?
I apologize.
That's okay.
I apologize. Senate District 50, Tom Facey.
Yes, I'd support that type of ban.
And last, Senate District 48, Mike Hopkins.
I think a previous panelist hit it on the head. I don't think that you can just continuously make everything that is either harmful to an individual or that you don't like for an individual to do. You can't just continuously make them all legal, nor can you just continuously tax them until they're unavailable, most often to low-income families. However, at the same time, I don't think that a 10-year-old or a 12-year-old boy or girl should be able to walk into a tanning salon and sit under a tanning bed without parental permission. So I think at the very least you hear quite a few votes on the panel for parental permission for tanning beds.
Thank you. And now for question number 7. For many low-income Montanans, family planning services are the only health care they receive. Services provided by family planning providers include contraceptive services, family planning counseling, pelvic and breast cancer exams, testing and treatment of STDs, and referrals for specialized health care. Family planning has been shown to reduce other state-funded healthcare costs. Would you like to see family planning funds increased, decrease, or appropriated at current levels? We will begin this off with Senate District 48, Mike Hopkins.
I don't know about increasing funding to them, but I think that they're extremely valuable organizations. I think family planning is extremely important, and it's had pretty big influence on my life in a number of different ways. So I certainly don't think that it should be reduced.
For Senate District 50, Tom Facey.
Thank you. Yes, I would like to see some increase in the appropriation. I'm guessing the number that might, the amount of money would be increased might not be that large, but needs an increase. I'd like to continue to see the state accept federal funds for this. These are good programs. Low-income folks need them because they're not getting health services other places, and this is a good place to start that. Thank you.
For Senate District 49, we will begin with Dick Haynes, to be followed by Diane Sands.
I don't know what level of funding exists now in the state, but I think I would support an increase. I've seen so many young mothers, particularly kids having babies. I think I think we need to deal with that problem. And I think more money along this line would help. I hate to keep, that seems to be the theme tonight on all these problems, just throw some more money at it. I think I would support throwing some money at this, though.
Madam Sands.
You know, the money that's used for family planning affects both men and women, and I think it's one of the core fundamental health programs that we have in the state of Montana and across the country. It's very effective in addressing both the need for education for people and access to services, and they do a particularly good job out in our rural areas. I think as a model, they're interesting to look at because they don't just focus on some service in a crisis situation, but they're really focused on prevention and empowerment of people to be able to make good health decisions in a variety of areas. I don't know what exactly the current health, the family planning funding level is. Title IX provides a good deal of federal match funds in this area. I think it's critical that we fund it. We certainly don't want to go back to what happened in 1981 when the legislature at one point decided to defund family planning, saying one of the legislators, let them use saran wrap.
I promise to only call on you once this time. For House District 92, Dave Strohmeyer.
We've heard from a number of folks tonight the keen and indeed acute significance of prevention and trying to address health issues before they really become issues that find someone in an emergency room somewhere. So absolutely, I would support increased family planning funds, which, as the question I think fairly well articulated, covers a whole range of different health care services.
For House District 98, we will begin with Willis Curdy, to be followed by Roger Seawald.
Yeah, I support funding of family planning programs. If you remember this past year, or maybe year and a half, Ravalli County next door to us chose not to use their Title X funds for low-income patients, women. I thought that was a travesty. Since counties are creatures of the state, I would see what I would like to do to make it impossible for counties to use ideological reasons for denying women the right to family planning and low-income women to quality, adequate health care. Sorry.
Mr. Seawald.
This is very similar to a question I got from the Missoulians, so I'm going to stay with what I said there, and not really knowing what the overall budget is and stuff. I certainly would keep it at the current level, and depending on what the budget is and the needs, might very well look at increasing it.
House District 94, Kimberly Dudick.
I would support increasing family funding. The Title X program the funding was cut from our budget last session. I don't know if you all remember that. We did just hear about in Ravalli County, they didn't use the funds, but the Republicans in our legislature actually cut those funds from it. It was $4.6 million in federal tax funds we weren't going to be able to use to provide essential health care services like birth control, breast exams, and screening for cervical cancer. This affects men, it affects women, it affects all families, children, and grandparents. What it became, though, was a partisan divide wedge issue where they were not saying we didn't want to accept the funding because the money would go to Planned Parenthood and it would fund abortions. There are quality controls in effect for Planned Parenthood, and not $1 went to fund abortions. But even faced with that reality, the Republicans in our state legislature refused to accept this money. It was a travesty for the people of the state to see the people who they've elected choose partisan politics over the health of the individual citizens. The Title X funding and the family planning services provide services mainly for women, and there are some men, but it's mainly women, about 85% in this state. But if you look at our state legislature, it's made up of about 28% women, with only 42 out of 150 individuals being women. So if you want to look at gender inequality that we've heard about as far as pay goes, we should also look at what our policies are doing in our legislature for gender inequality.
House District 90, Ellie Hill.
Yeah, as you can hear, Representative Dudick and I, we get pretty fired up about this because Title X clinics provided contraceptive care to nearly 22,000 women in Montana in 2012. Of course, I would support increasing funding, but the issue, as Representative Dudick said, is that nobody's trying to increase it. They're trying to gut it. They're trying to gut it over ridiculous partisan divides. I've served on House Judiciary the last 2 sessions, 13 abortion bills last session, and they're the same 13 abortions bills we heard the session before that, and Roe v. Wade passed before Representative Dudick, Representative Bennett and I were born. You know, we keep doing the same thing over again. Rush Limbaugh's calling Sandra Fluke, a college student, a slut on national radio for using a Planned Parenthood clinic. Accessing birth control is a right. This is not one federal dollar goes to abortion, not one. There's a federal mandate that says that they can't use it for that, but yet the myths, the lies on Fox News and in the Montana legislature continue, and it's offensive. To cut $4.6 million in federal funds for our clinics in this state, it's offensive. Thanks.
House District 91, Bryce Bennett.
Thank you. I agree with a lot of what the last two speakers have said. And from our experience in the Montana legislature, it's not a question of will we increase a little or will we cut it back a little bit. You know, I'll tell you my personal experience as a member of the Education Committee was specifically around sex education in our schools. And there were numerous bills that were brought forward specifically for the purpose of gutting funding out of those programs and making it harder for students to access comprehensive, age-appropriate sex education. You know, we've seen what's happened in other states when that doesn't exist. I mean, the cases of chlamydia go up, the cases of gonorrhea and syphilis and all these other things like unwanted pregnancies and even HIV/AIDS goes up amongst our young people, and some of those are a little bit more curable than others, obviously, but it is a huge problem. I mean, when we have family planning money going to smart programs that are incredibly effective, it's a tragedy when we try to peel those programs away. You know, I want to highlight one program specifically. There was a program that's moving into high schools all over the place where they're training young people, these 13, 14-year-olds, about smart and accurate information about safe sex, so that it's not just some adult trying to tell you how to be, you know, safe when you're, you know, having sex as a young person. It's your peers who are giving you actual information, and the state legislature tried to unfund that, and I would love to see that amount increase, not decrease at all.
For House District 93, Susan Evans.
I'm looking at a pen here from the Salish Kootenai College Prevention Task Force. It tells me that 1 in 2 people will get an STD by age 25. That's astonishing. Family planning clinics will help prevent this. Family planning clinics and prevention programs such as the one here at SKC. We need to keep these programs going because a woman needs to know what's happening to her. A woman needs to know how she can best use her life. A woman needs to know that she can choose to have a baby when she chooses to have a baby. And when she does choose that, she needs to have adequate health care. She needs to have nutrition information because that baby's life depends on the mother's well-being. A baby born to an alcoholic mom is born with what we call fetal alcohol syndrome, and that child will never, ever be smart enough to match a good job or to get along in their life. I personally know some kids who are fetal alcohol syndrome affected, and they're sweet, and they're wonderful, and they're dumb as a post. We can prevent that with adequate programs, and this is part of it, is family planning and family prevention. But planning your family, I waited till I was 33 to have my first baby, and I just delighted in the whole process. Thank you.
And now for question number 8. How can Montana address the need for more doctors, nurses, and other healthcare professionals, particularly in our most rural communities? We will begin this with Senate District 49. We'll begin with Diane Sands, to be followed by Dick Haynes.
Thank you. This is a topic particularly of interest to me. I grew up in eastern Montana. I still have a lot of family in eastern Montana. And for the last few years, I have worked closely with a number of groups, including there's an advisory group of hospital officials, et cetera, and the University of Montana looking at how to increase residency and how to increase the number of health professionals in the state of Montana. That includes everything from increasing paid residencies in our hospitals and our community health centers, under the expectation that if you can get those students to come here and do a residency, they will stay here. So we've been working on that. But there are some other things. One of them I would mention is expanding the scope of practice, particularly for mental health services. I know when we were dealing with the fact that there were no psychiatrists, for example, in private practice in rural eastern Montana, one of the bills that I worked on was to change the scope of practice for nurses so that they could, in fact, begin prescribing in that particular area. So we have to get very innovative when we're trying to deal with how do we provide increased services and personnel in healthcare areas, particularly in rural eastern Montana.
Mr. Haynes.
By golly, Diane, I almost agreed with you on some of that. I think we should do something along the lines that would pay off the bills or support doctors and nurses during their training, with the idea that they come back and spend a certain number of years somewhere in Montana, and we would write off their debt to us. Kind of like what the military did for a long time, where you went where you were posted and did your duty for 2 years, and you were free to go where you wanted. I think the cost of becoming a doctor or a nurse today is horrendous, and I think we could talk a lot of these people, and a lot of young people I know that are in the medical field are getting there, are a little nervous about going to some faraway place out in the boondocks in Montana. But the ones I know that have gotten there, some of them don't want to leave. They like it. So I think there's some potential to support them, to do away with some of their costs, and that'll keep them in the state. We won't keep them all, but we can keep some.
For Senate District 50, Tom Facey.
Thank you. The 2013 session passed a residency program which increased, I think, 10 slots in Missoula and 10 slots in Billings, which was great. That was a great first step. We need probably to increase that in a decade. The idea there was if we have the doctors do their residency in Montana, and we're going to keep them when they leave that residency program. Second thing we can do is increase our support for our number of slots in WWAMI. WWAMI is a cooperative program. It's in Washington, Alaska, Montana, and Idaho. It's basically our medical school. They go to school for the first year in Bozeman, and then they transfer to Seattle. We could increase those number of slots. I think all these programs, we can institute a loan forgiveness program. We probably need to expand our existing nursing programs to the Montana university system and our tribal colleges. And it's a problem we've been working on, but we need to continue to work on for the next several decades. Thank you.
For Senate District 48, Mike Hopkins.
I think a lot of what you heard from the last three panelists were the majority of good ideas. Debt forgiveness is obviously a bonus for any student that is carrying a very large student debt. At the same time, I think that you kind of have to deal with the fact that the entire view on the profession itself has changed in the last 10 years. And a lot of the reasons why people go into the profession is obviously to help people, but it's also so that they can make a good living. And I think that as long as that area of our economy is rather up in the air as far as what it looks like 10 years out, you'll have people that aren't all that interested in staying in it.
House District 93, Susan Evans.
I think we, how do I say anything more than the first three folks said? The loan forgiveness program, I think, is an absolute necessity. The cost of any college education is just astronomical, and that needs to be addressed across the board. As far as medical professionals, perhaps we could intern them as a paid summer intern, and that would then encourage them to spend more time in Montana, and after you spend time in Montana, you can't help but love it. I think that scholarships and loan forgiveness and any kind of help we can give to aspiring medical professionals is vital to their success and to just feeding the profession altogether. And I don't think we can really do enough to help the people who are keeping us alive. Thank you.
House District 91, Bryce Bennett.
I think most of the people before me touched on just about everything that I was going to mention as well. But I was very happy that during our budgeting process last time we increased our WWAMI slots to make sure that more people have access to medical school. I mean, there's a lot of research that says that if people do their residency here in Montana or wherever they happen to be, they end up staying there. So the more people we can have doing their residency here in Montana, hopefully the more we'll be able to retain into the future. Obviously, one of the big things that I think has been mentioned maybe once before is providing some incentives for specialists. We have a real need, especially in rural areas, for people who aren't just general practitioners, but people who have a real specialty for specific things that they might be able to provide that extra service, because oftentimes when people need those specialists, they have to go drive for quite a long time to get that service. So whatever we can do to make sure that those people with those special skills are able to get into those rural areas as well, so it's not something just for those of us in the city, I think it's going to be a big help.
For House District 90, Ellie Hill.
Thanks. Yeah, what Senator Facey said about the success, that bipartisan success we had last session to get the whammy slots and the higher residency placements, it was a miracle. Frankly, we had to put what I call a slippery pig through the House, because frankly in the House you have three parties, and so we just put a bill through that was fairly nondescript, and then they put the guts in it in the Senate, where more moderate minds could make it happen. I just wanted to share again that, from my perspective, the number one way we can reach our rural communities, and the way that our doctors and nurses are telling us to do that, is by passing Medicaid expansion, which is why, again, the Montana Hospitals Association, rural health, public health officials, nurses, all supported it during the last session, and I hope moving forward we'll support it again. Other than that, I will defer to my friend Representative Dudek on the rest of this, because as a registered nurse and attorney who grew up in Frenchtown, I think you should listen to her.
House District 94, Kimberly Dudek.
No pressure with that introduction. Actually, I did grow up in Frenchtown. My parents still live in the same house where I grew up in, and they watch my kids a few times a week, so I'm pretty darn lucky that I have that. But I know a lot of people in our rural communities, when they get older, they aren't able to stay in the places they grew up, and it's hard for them, especially as they get older, to take care of the land that they have. So I'm kind of getting around to our question here, but we need to look at how to address those needs. And we've heard good ideas. We've heard about increasing the whammy slots, increasing the residency spots, and loan repayment programs. But we've heard that we all think that's a good idea. Not everyone in the legislature does. And that you need to go back and look at the voting records of people in the legislature. I served on the Appropriations Committee, and people tried to decrease the number of whammy slots and the number of residency slots were available. So if you're electing people and voting for people, you need to know what they're going to do for your health care. And too many times we see people voting by just party line, Democrat or Republican, and not getting to know the individual record of the person they're voting for. It is very essential for the voting public to be informed who they're voting for and what that is going to mean for them in the end. As far as one other thing we could do, though, is in the outlying regions, it's hard for specialists to actually have enough income from that area to be located there, but we could do visiting specialist programs where somebody like a pediatric neurologist or something could come once a month and visit out there. And if we did visiting programs like that, it could increase access to health care.
House District 98, we will begin with Roger Sewell, to be followed by Willis Curdy.
I want to go back to question 4 when I brought up the subject about loan forgiveness, or working off their student loans, I guess is a better way to put it. It's not loan forgiveness, it's they're putting in time to work off that student loan. I think there's some other things that aren't just off the top of my head. They may sound like it, but they're not. When we're talking about additional health care in rural areas, one impediment to doctors in a lot of areas is malpractice insurance. Now, if there's a way something can be set up, and I'm just, for lack of a better name, a rural doctor co-op, where you can put a lot of doctors together to get malpractice insurance as a cooperative or something on that line, to try to cut down those costs for the individuals and make an incentive for them to be in places that are rural. Thank you.
Mr. Curdy.
Okay, I agree with everything about expanding the number of slots, WWAMI, and all the other programs. That's really great, and we need to continue with that. But, again, goes back to Medicaid expansion. Medicaid expansion has shown in other states that it improves the bottom line for rural hospitals. That will encourage doctors, nurse practitioners, physician's assistants to go to those hospitals and work. And we have the technology now where we can literally bring a rural hospital patient to a medical center without them physically being there. And we need to take advantage of that. Physician reimbursement is another issue. Incentivize reimbursement in rural communities and loan forgiveness. So, you know, everything's been said, plus maybe a few other ideas out there that will make this come to pass. But it is a serious problem, and we need to address it.
House District 92, Dave Strohmeyer.
So I think one danger of candidates for office, myself included, who are currently not serving in a specific legislative body that they're running for, is offering solutions that have already been addressed or are in the process of being addressed. So I will not belabor many of the good ideas that have been offered here so far tonight, which I think are worth pursuing in the next legislative session. I will offer a couple other thoughts and an observation. The observation is, running for a district like mine that stretches clear up to Condon, Montana, there's a lot of acreage out there and a lot of miles to cross for folks to be able to access healthcare services here in Missoula, for instance. So definitely anything that we can do to enhance people's ability to find healthcare services in their own backyard in like Sealy and Condon would be great. One thing that I think that we can probably continue to pursue is partnerships and collaboration with the federal government, because this is not just unilaterally a state issue. A lot of the folks who I interact with are military veterans, veterans who have difficulty finding the services that they need at a convenient location. So certainly collaborating with the Veterans Administration, among other federal agencies, I think would be critical.
Thank you, candidates. And that'll bring us to an opportunity for audience questions. If we do not have any questions from the audience, we will just continue down our pre-approved questions. But are there any questions from the audience? Going once? Oh. I'll come to you.
Okay, being one of the youngest people here, I guess, I have a question. I have 3 young children also that are going to be entering school soon. And a few of you touched upon it about the sex education in schools. And so I'd like to ask if, you know, kind of where do you see that going? Increasing, decreasing? What do you want to see as far as sex education in schools, even starting as far as elementary schools?
Thank you very much for the question. We'll begin with House District 93, Susan Evans.
Babies didn't come from under a cabbage. And our children need to know that right from the get-go. There are many parents who are reluctant to discuss the process with their children, but there are adequate ways for that to happen. If we don't tell them how it happens, their peers will, and they will give them bizarre information, and some people will get scared half crazy. I think it's important to address this with very young children in an age-appropriate manner, and I think that the teacher in the classroom is the most likely person to judge when and how that is appropriate. We can rely on our professionals, and they can design a program that we can use. Thank you.
House District 91, Bryce Bennett.
I'm a strong supporter of sex education, and I don't want to see any efforts to take away the ability for young people to get the information they need. I think the phrase that is important to push again and again, because there's a lot of confusion around this, but it's comprehensive, age-appropriate sex education. And that means that kindergartners aren't getting lessons about intercourse. Kindergartners are learning important lessons like good touch, bad touch, and avoiding strangers in some of these situations. That's the kind of stuff that they need to learn from an early age to make sure that they're protected. Later on, when kids are going through puberty and they need to learn about what those feelings are about and their changing bodies, that's the time when we start talking about intercourse. But making sure that people know the right information, because I assure you that people are talking about it. And just as Susan mentioned, I mean, that's the information they're going to get from their friends. We want to make sure that they get the right information to keep themselves safe. I'm a huge supporter of this peer-to-peer education idea that I saw in the last legislature. I love the idea of giving young people the proper information so that when their friends ask them and they can be a resource, they can give them the actual information and not just the kind of rumors that are floating out there. So I think it's incredibly important to make sure that sex education continues moving forward and make sure that everybody gets the right information at an age-appropriate time.
House District 90, Ellie Hill.
Thanks a lot. Yeah, I totally unequivocally support sex education in our public school system. I have 2 boys at Lewis and Clark right now. I will share with you that last session we did see attempts to curtail public education, sex education in schools, both brought to us at the behest of Jeff Lafsley and the Montana Family Foundation and Representative Carrie Smith from Billings. I'll share with you that both the Montana Family Foundation and Carrie Smith not only attempted to gut medical marijuana in the state of Montana, but despite the United States Supreme Court and the Montana Supreme Court saying that it was unconstitutional to have a bill on the books making it a felony to be gay in Montana, they fought like hell to keep that on the books. And I'm thankful to say that both Republicans and Democrats joined together to take that off the books last session. So we're dealing with folks that will ignore not only the U.S. Constitution, but our state constitution when they craft these legislations. I will tell you that both bills by Carrie Smith were defeated with bipartisan support. In the case of House Bill 239, it was vetoed by the governor, but in 423, another attempt to limit sex education failed on the second reading in the Senate. So it can still be done, and we still have what we need and have in Montana, which is, as Bryce said, appropriate aged education about sexuality in our Montana schools.
House District 94, Kimberly Dudek.
I fully support sex education. We're supposed to give our children a full education, and that doesn't include just how to do algebra and how to do addition. It also includes how their body works and how to keep themselves safe. There are multiple age-appropriate education programs out there from kindergarten through high school that will keep our children safe, and we have a duty to give them that education. Forced ignorance about how you get pregnant doesn't stop people from having sex. It actually increases the number of unintended pregnancies. Probably increases the number of STDs and other health problems associated with them. So not giving sex education doesn't stop people from having sex, and it doesn't really do anything other than make our society worse for those children. That's all.
For House District 98, we will begin with Willis Curdy to be followed by Roger Seawald.
Okay, as one of the 2 professional educators in this room, or this table, I do not like to use the 3-letter term that everybody's used so far in describing this curriculum. I refer to it as comprehensive health education. Comprehensive health education that is appropriate. It deals with issues, not only deal with bodily functions and activities, but also self-esteem, interpersonal relationships. These other topics help reduce suicides, reduce domestic violence, reduce sexual assaults. We need to use the best, most scientific, proved method of comprehensive health education out there. And of course, the bottom line is to reduce teen pregnancies. That's enough.
I think back to 9th grade, and most of you here, that's before you were born when I was in 9th grade. We had sex education. There were no holes barred. I realize that's 9th grade, and that's a long time ago. And I beside myself when I hear people not wanting people in school. And I like the way Bryce put it. He said, age appropriate from the standpoint of young, good touch, no bad touch, okay? And then it goes all the way up to then it's good touch, bad touch again, but in a different meaning. You know, I think that if there's concerns from parents, parents need to have the ability to opt out for their children not to be in it. And that's the only restriction that I would put on it is if they do not want them to have it, then they can withhold them from it.
Thank you very much. House District 92, Dave Strohmeyer.
Yeah, whether we call it comprehensive health education broadly conceived or more narrowly as the question was leveled, sex education in particular, I think we absolutely need it in our public schools. And I have no more important reason than the reminder my two little kids in elementary school give me every day that they are much more perceptive and much smarter than I think we sometimes give them credit for. And I think over the time, probably many of us at this table here tonight have forgotten the intellectual ability of 8, 9, 10-year-olds to understand the birds and the bees and our health issues related to our own body. So age appropriate, absolutely. But let's keep in mind that kids are a lot smarter than we sometimes give them credit for.
For House District 49, we will begin with Diane Sands, to be followed by Dick Haynes.
Well, I go back to what Willis said. You know, it's really about a comprehensive health curriculum, and which we don't really have in the state of Montana. And thank God the Montana Constitution prohibits the legislature from mucking around in specific curriculum. We've seen a lot of crazy bills over the last 40 years having to do with sex ed and other kinds of things. I think part of our difficulty here is we tend to approach these as sort of silo crisis problems: drug abuse, sex, smoking, etc. I think we would be much better off if we developed a comprehensive plan so that every kid coming out of school has some comprehensive knowledge of how the human body works, the skills to be able to make really good, educated decisions for themselves about how to consume health care, how to be a healthy person. If we had a comprehensive plan so that every kid coming out of school has good health habits in the sense of a commitment to some exercise program as being part of their life. In the long term, we come out with kids who are healthier and who cost us a lot less down the line in terms of trying to address problems after they've already arisen. And so I think comprehensive health care education, which should be not instituted by the legislature, but at the local level. Thank you.
Mr. Haynes.
This is dangerous, Diane. You're making sense. I'm past the children stage. We've got my two kids are having kids of their own right now, and then watching them right now, very energetic 8-year-old and 7 and 6-year-old. And I think their parents and the school system, and they're in another city, they're in Boise, and I think they're handling all those things appropriately. Our experience over the years as we raised our first family was that it depended on where you lived, because we lived in several different cities and in Montana. And I think the concern over sex ed today, and as Diane says, all aspects of health education and how you grow up and what you do and what you shouldn't do, at this point in time, I'm not much in favor of the state mucking around in that.
Senate District 50, Tom Facey.
Thank you. Montana is what we call a local control state when it comes to education. The local school board gets to determine the curriculum. As many of the speakers have spoken eloquently about that, but understand the state legislature must stay out of this. The Constitution says you can't get into it, and it's local control. I trust those local school board to make the decision that's best on what curriculum is for them. I did sponsor in 2001 House Bill 557, which would have required the local school board to tell OPI what their health comprehensive research-based age-appropriate curriculum was. So that bill, pardon me, sort of asked the school board to look at the issue, come up with a comprehensive age-appropriate complete health curriculum. But again, it's a local control issue, and that's where it should stay.
And last, Senate District 48, Mike Hopkins.
I think you've heard a lot of what you need to hear. It's a local control issue, so my opinion as a potential legislator, I guess, would be that the term age appropriate in and of itself is a little bit nebulous, and that it would obviously depend on what the actual curriculum looks like. And I think not only is parental notification important, but I think the parents should be able to see that curriculum ahead of time and have the option of saying whether or not they think that that's too upfront for their children or not, and have the option of taking their child out of the class before the class actually happens, rather than responding to whatever happens in a class after it happens. But sex education is pretty important as long as the curriculum is put together well. Good to go.
And that concludes this evening's forum. I would like to let everybody in the audience know, as well as the candidates, that MCAT will be displaying tonight's forum on Channel 199, October 14th and October 17th at 5 p.m. each day. I would like to thank the AARP, the American Cancer Society Cancer Action Network, and the Associated Students at the University of Montana for putting on tonight's forum. I'd like to thank MCAT for recording it for viewers later on. And on behalf of all of the sponsors of tonight's forum, I'd like to thank the audience, the viewers at MCAT, and tonight's candidates. Thank you very much. Good evening.